research guidelines. We focused our research to specifically children from birth to age 5, including all races in the United States of both genders. During this presentation, we will be explaining what a vaccine is, how it works in the body, giving some examples of common vaccines, and we'll be showing statistics and images about vaccines. To begin, we need to define what a vaccine is. What is a vaccine? A vaccine is a type of medicine that trains our body's immune system so that it can battle any disease it has not come into contact with before. Vaccines have been designed to prevent disease rather than treat a disease once you have caught it. How vaccines work. To understand how vaccines work, it helps to look first at how the immune system works as well. The immune system reacts to a vaccine in a similar way that if it were being invaded by the disease, by making antibodies. The antibodies destroy the vaccine germs just as they would the disease germs, like a training exercise. Then they stay in our body, giving us immunity. Vaccines. Some examples of common childhood vaccines including diphtheria, tetanus, and pertussis, known as the DTNP vaccine. It is a 5-dose vaccine given first at 2 months, then 4 months, 6 months, 15 to 18 months, and the last dose should be given between the ages of 4 to 6 years old. Hepatitis B vaccine. This is a 3-dose vaccine which should be administered at birth, 1 to 2 months, and then lastly at 6 to 18 months. Polio vaccination. It is a 4-dose series, with the being given at 2 months, the second dose at 4 months, the third at 6 to 18 months, and the last dose at 4 to 6 years of age. MMR, known as the measles, mumps, and rubella vaccine. It is a 2-dose series as well, and the first dose is to be given between 12 to 15 months, and the second is to be given between 4 to 6 years. Varicella vaccination, known as the chickenpox vaccine. It is a 2-dose series in which the first dose should be given between 12 to 15 months, and the second should be given between 4 to 6 years. Meningococcal vaccination. This is better known as the meningitis vaccine. It is a 2-dose series, with the first being administered between 11 to 12 years of age, and the second being administered at 16 years of age. Influenza vaccination. Should be given 1 dose every year for all children ages 6 to 8 months who have received at least 2 influenza vaccines doses before July 1st, 2019, then 1 dose per year for each person 9 years and older. Vaccine exemptions in every state map. This map represents which states have medical, religious, and/or philosophical vaccine exemptions. 10 of the states that reported having measles outbreaks were also states that had vaccine exemptions for medical, religious, and philosophical reasons. As you can see, there are also states that only allow religious and medical vaccine exemptions, which accounts for the majority of the United States. How to prevent more outbreaks? One effective way to limit the number of outbreaks is to vaccinate children. However, 1.3% of children born in 2015 had not received any vaccinations by 2017. That number does not seem significant, but one child could infect another, and then we have a disease spreading throughout the whole country. Some reasons why children aren't vaccinated include racial difference, economic inequality, health insurance inequality, religious affiliations, and medical mistakes in vaccine distributions. This map shows the states that had measles outbreaks in 2019. As of April 2019, there were almost 700 recorded cases of the measles across 22 states. The only proven way to effectively lessen the number of outbreaks in the United States is vaccinations. Racial differences. Racial differences had an influence on the attainment of immunizations among impoverished children. European American children received a higher amount of diphtheria, tetanus, and whooping cough, Haemophilus influenza type B, vaccines that regulated red blood cells, as well as hepatitis A, while marginalized children, particularly among low-income African American children, received a lesser amount of vaccines mentioned above. Economic inequality. Economic inequality was one reason for the reduction in immunizations among impoverished children. 76.6% of marginalized children, particularly among African American children residing below the poverty level, did not receive diphtheria, tetanus, and whooping cough vaccines. Health insurance inequality. Health insurance disparity was a subsequent reason for the reduction in immunizations among impoverished children. A relationship between the absence of immunizations and the lack of health insurance was found among marginalized children, particularly among low-income African American children. A relationship between the lack of immunizations and the provision of government-issued medical assistance was found among marginalized children, particularly among low-income African American children. A relationship between a frequent stoppage of Medicaid assistance and inconsistent immunizations was found among marginalized children, particularly among low African American children as well. However, access to adequate health insurance was a factor in obtaining frequent immunizations for non-marginalized children. Private insurance was associated with frequent immunizations among European American children. Religious beliefs. Renee Najera from the College of Physicians of Philadelphia said that the main conflict is between science and religion. She explains that the Catholic Church clearly supports vaccinations, however, other religions are not so straightforward. It's difficult to explain how vaccines work exactly, so people who do not understand it do not get the vaccines for themselves or for their children. Christian Scientists of the Church of Christ and the Dutch Reformed Church are just two examples of largely practiced religions in the United States that are openly against vaccinations. Other religions are against vaccinations because of their diet. For example, Muslim religious authorities believe vaccinations are unacceptable because vaccines contain pork-derived products. Contributing factors. There are a number of errors made in every aspect of medicine across the country. These are statistics based on the entire country. So 17% of all vaccines distributed were given to the wrong age group. This is the most common mistake made because of poor judgment calls. Temperature management is another important factor that accounted for 15% of mistakes made in vaccine distributions. If the vaccine's temperature drops below or raises above the acceptable range, the doses may need to be discarded. Expiration dates on vaccines also should be checked weekly. Although mistakes do happen, scientists are constantly developing and improving vaccines to improve their effectiveness. The CDC is always releasing new regulations to follow regarding the distribution of vaccines, and doctors and nurses are constantly being updated and retrained to keep up with the new trends in vaccine distribution. There are a million reasons why vaccines are bad or you shouldn't get them. So what happens when you don't vaccinate your children? What happens if children aren't vaccinated? Without vaccines, children are more likely to get and spread diseases that are circulating. There are many long-term effects of not vaccinating your children. The major and quite obvious one is that your child is more likely to get diseases that leads to more serious issues. For example, measles causes brain swelling, which can lead to brain damage or death. Mumps can cause permanent deafness. Meningitis can lead to permanent deafness or brain damage. And polio can cause permanent paralysis. Not only does this affect your individual child, but every single person that your child interacts with. Communities depend on high immunization rates to keep vaccine-preventable diseases from spreading. When more people are immunized, there is less risk for everyone. There is an image of two boys. Both boys were exposed to smallpox. However, the difference between these boys is that one received the smallpox vaccine and the other did not. Why should I vaccinate my children? Vaccines are safe. The FDA will not license a vaccine unless it meets standards for effectiveness and safety. Results of studies get reviewed again by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians before a licensed vaccine is officially recommended to be given to children. Every lot of vaccines are tested to ensure quality before the vaccine reaches the public. In addition, FDA regularly inspects places where vaccines are made. According to the World Health Organization, immunizations prevent 2 to 3 million deaths per year. It is one of the most successful and cost-effective public health interventions.